sports medicine. We cover a couple of professional level teams, the women's the women's pro soccer team in Seattle called Seattle Reign. We also cover Seattle University, Division I. So they're pretty big in soccer and basketball. They don't have a football team, actually. Okay, so this was the Seattle Reign. They just completed their season. Unfortunately, they lost in their final last week. But they won the division. They won the Shield title, second year in a row. There's a couple national team players on here. Yeah, my pointer's working. Okay, so there's Hope Solo, and Megan Rapinoe. So they were on the Women's World Cup national team. So we cover them. We're on the sidelines. You know, we manage their medical issues. And the season is actually going to be extended because the league added 3 teams. So they're going through an expansion period right now. So next year is an Olympic year. So it's kind of big for U.S. men's and women's national teams. Okay, so what is sports medicine? So basically we take care of athletes and anybody who does exercise. Typically the things you think of are orthopedic style injuries, muscles, bones, joints, tendons, ligaments, those kinds of things. We also see lung issues, asthma, rashes, cold, virus. When you guys get sick, you usually come to see us. And so, you know, we are also interested in prevention of injuries, and we also look at physiology of exercise, trying to improve your performance, improve your function, improve your times, get you guys better. Origins trace back to ancient Greece and Rome. Physical education was part of their daily activities and daily life. They started developing trainer coaches on which they worked on diet, exercise, sport-specific techniques, meaning proper training, and hygiene was a big deal back then. One of the teachers of Hippocrates, Herodotus, was thought to be one of the first users of therapeutic exercise. But team doctor didn't come around until Galen in about the 2nd century when he was taking care of gladiators. But that was only when there were an injury, and usually they died. Modern era says really came to fruition through the Olympic system. It came down from Canada. Dr. Kennedy was considered one of the founders of sports medicine and the Olympics. Basically realized that the Canadian teams needed a centralized medical team, having a physician, having physical therapists, having a whole team taking care of these Olympic athletes rather than disorganized system. And so 1972 was the first time he came around as chief medical officer with the first official medical team, and other countries soon followed suit. So in the U.S., the Olympic Training Center is in Colorado. There are designated physicians and sports medicine teams all in Colorado where they train these Olympic athletes, and similar systems exist in every country. So this is basically the overview of who's involved with sports medicine. It's athlete, physician, physical therapist, athletic trainers, exercise physiologists, strength and conditioning specialists, dietitians, chiropractors, psychologists, coaches. So it's a large group. This was actually the ABP this past summer that was in Issaquah, Kingston tour. They haven't been in Seattle in like 4 years. So this was kind of a big deal. So as a physician, we treat predominantly orthopedic injuries, so pretty much any joint muscle that you can think of. We see fractures, we see sprains, we see strains. We also treat asthma, heart problems, concussions is the latest buzz. So brain injuries, head injuries are a big deal now. It's a big part of my practice. Abdominal injuries, there was a football death in New Jersey a couple weeks ago. He had a spleen rupture. So abdominal injuries do occur in contact sports, skin problems, eye injuries. And we see pregnant athletes too, taking care of a women's team. It does come up. Our predominant focus is to get people back into action. So get them back to the field, get them back into playing. Our goal is not to hold people out, to prevent them from playing sports. It's basically to get a fast recovery and get them back in without causing further harm or any long-term detriment. And that's a difficult balance, especially with concussions and brain injuries. You want to let them heal, but you don't want to get them back too soon that they have another injury and something catastrophic. Physical therapists, These are the ones who rehab majority of the athletes. The kinds of things they see, they see sprains, strains, fractures, burns, arthritis, amputations, injuries related to work and sports. Athletic trainers are basically field medics. So they are on the field. They're the first responders. When somebody goes down, they're the first people to get out there in the field, and they assess the situation, and they help with triage. So sometimes it'll be neck injuries, spine injuries, broken bones. They're the ones there that are stabilizing. But they also cross over into the physical therapy realm, where they provide rehab to these athletes after an injury. So in the locker room, training room, they're taping people up, they're rubbing people down, they're giving massages, they're doing exercise. So they are integrated into the teams, and we work closely with them as physicians. They're there with the athletes almost all the time, and we can't be there all the time. So you see them in universities, professional teams, high schools. We do have them in the hospital setting now. It's becoming more common in the offices as well. You also see them in fitness centers. Exercise physiology. So these are more in the research realm. You see them in colleges and universities. They have a physiology lab. Basically, they get you on a treadmill, they hook you up to a million different devices, they see what your VO2 max is, and they try to improve your performance. And they're constantly doing research and studying and determining, what's the appropriate treatment to rehab athletes and also improve their performance. Strength and conditioning specialists, similar to the trainers you see and hear in gyms. A lot of football teams are incorporating them. So proper form, proper technique. They do specific testing to see where the deficits are and improve. And they also help with injury prevention. Dietitians, nutritionists, becoming more and more of a big deal, making sure you guys are getting your nutritional needs, getting good programs in. There's a lot of diets out there, paleo diets, there's a lot of fat diets which are related to losing weight, which are not optimal for somebody who's in training. You don't want to be losing weight when you're in training, so you want to make sure you get enough nutrition. They also see people in hospitals, so they're seeing the critically ill, people with kidney problems, diabetes. Psychologists, so that's what you're learning about. They do work directly with athletes to increase their motivation and enhance their performance. So we utilize sports psychologists quite often for consulting, depression, divorce, death of a loved one, performance anxiety, adjusting to new schools, countries, cultures. We have a lot of kids from Seattle University who are from other countries. They've never been to this country before. They have no idea what's going on. They feel completely lost and they're isolated. No family is here. And then after an injury, recovering and rehabbing after an injury. So you go down with an ACL tear, it takes about a year to get back. There's a lot of fear of re-tearing your ACL. So what is sports medicine? Not only do we try to fix injuries, cure them, rehab them, but we're also trying to prevent injuries. So we're doing more and more screening to see if there's any training errors, are there any functional deficits, trying to prevent an injury from occurring so you're not in the middle of the season, you go down and your season's done. We do baseline testing for concussions. We also screen for heart problems now because actually the #1 cause of death on the field is somebody going down with a heart issue. Sometimes there are abnormal vessels in the heart, abnormal rhythms, so screening ahead of time, trying to prevent that from occurring. Also addressing nutrition, improving performance, and overall health and wellness. A lot of the times the only thing we see are kids, and they haven't seen a pediatrician or anybody else. Injury.
Really quickly, the nutrition part.
Mm-hmm.
How often do you find the nutrition experts are incorrect in kind of the work that they're doing? Because I know that there's probably a big carryover between the medical doctors that's part of their scope, but then also you have the nutritionists that that's basically what they're doing. How often is that a problem?
In our world, it's not a really big problem because we pick the nutritionists that we work with. We develop a plan together. We work together.